Hello everyone. So we'll talk about schizoaffective and schizophreniform disorders. So what is the definition of schizophreniform disorder? So it's a disorder where individuals experience schizophrenia-like symptoms for a few months and often return to normal functioning. So the symptoms of schizophreniform disorder may last for up to 6 months and may disappear due to treatment or for unknown reasons. Lifetime prevalence is around, approximately around 0.2%. So what happens if the disorder continues after symptoms continues after 6 months? It will be given a diagnosis of schizophrenia, but before 6 months we do consider it as a schizophreniform disorder. And in the diagnostic criteria, these are some key points that you have to remember. So the onset of psychotic symptoms within 4 weeks of the first noticeable behavioral change. So the psychotic symptoms start within the first 4 weeks, within 4 weeks of the noticeable behavioral changes. Confusion at the peak of the episode, good premorbid social and occupational functioning, that is before the onset, there is good social and occupational functioning, and no blunted or flat affect in schizophreniform. Okay. So the criteria A says that two or more of the following each present for a significant portion of time during a 1 month period. At least one of these must be one, two, or three. So at least one of the symptoms must be delusions, hallucinations, or disorganized speech, and at least one from all this, so at least two from all these five, and one from the first three symptoms should be present. And criteria B says that an episode of the disorder lasts at least for 1 month, but less than 6 months. So this is very important that the disorder in schizophreniform, it lasts less than 6 months. The symptoms do last less than 6 months. And criteria C talks about differentiating schizophreniform from schizoaffective disorder and bipolar 1 disorder, because in bipolar 1 also psychotic symptoms are present. So it's important to differentiate between bipolar 1 with psychotic disorders and schizoaffective disorder. Criteria D talks about that the schizophreniform symptoms, the psychotic symptoms, shouldn't be because of any substance or any medical condition or any medications that the individual is using. So what happens is that in some cases, the psychotic symptoms might be caused because of the substances, like there are some hallucinogens. Because of this, because the individual has consumed these substances, the individual might be having psychotic symptoms that shouldn't be considered as a schizophreniform symptom. Okay, and also we have to be careful and in checking whether the individual has any kind of organic issues, like for example there might be some kind of brain damage, right, which might be causing psychotic symptoms. So we have to be careful in understanding if it's caused by a substance or a medication or medical disorder. If yes, then it shouldn't be considered as a schizophreniform criteria. Right. Next, we can specify, like we can specify whether it's if the disorder has good prognostic factors or without good prognostic factors. So prognosis itself means that the outcome of the future outcome of the disorder, right? So schizophreniform disorder usually has a good prognosis, but in some cases it does progress into schizophrenia. But we can give a specifier whether it has good prognostic factors. So how do you give this specifier? So this specifier requires the presence of at least two of the following features: onset of prominent psychotic symptoms within 4 weeks of the first noticeable change in usual behavioral functioning, confusion or perplexity, good premorbid social and occupational functioning, and absence or blunted or flat effect. So if these four symptoms are present, it means that the prognostic factors are good. So without good prognostic features, so this specifier is applied if two or more of the above features have not been present. So for example, let's say the premorbid functioning, the premorbid social and occupational functioning is affected, then the prognosis of the disorder might be bad. The prognosis of the disorder might not be good, or let's say there might be some blunted or flattened effect, right? So then it also means that it's very likely that it will progress into a schizophrenia. So we say that the prognostic factors are not good. Okay. So you can also give a specifier of catatonia. So with catatonia or without catatonia, catatonia, as you already know, basically the psychomotor symptoms associated with schizophrenia. So here we'll next we'll talk about the difference between schizophrenia and schizophreniform disorder. So the first difference, major difference, is the duration of the disorder. In schizophreniform, it's between 1 month to 6 months. In schizophrenia, it is usually more than 6 months. And in schizophreniform, the onset is mostly rapid onset, but in schizophrenia, I'm sorry, in schizophreniform, the rapid onset is there. In schizophrenia, it's a gradual onset. Okay. So when we talk about hallucinations and delusions, so in schizophreniform, it might resolve, but in schizophrenia, it is something which is persistent. Okay. So when it comes to cognitive and social decline, very minimal cognitive or social decline in schizophreniform, but very significant cognitive and social decline in schizophrenia. Okay. So when I talk about prognosis, so usually schizophreniform has a good prognosis compared to schizophrenia, because schizophrenia does have a lot of symptoms like cognitive decline, social decline, a lot of functional occupation impairments, and so it's also something which is very pervasive. So the prognosis of schizophrenia is poor compared to the prognosis of schizophreniform. Okay. When we talk about blunted or flattened effect, in schizophreniform it's absent, in schizophrenia it's present. Okay. So treatment for both the disorders are almost the same: antipsychotic medication, psychotherapy, and support. Okay. So next we'll talk about schizoaffective disorder. So in schizoaffective disorder, it's a disorder where individuals experience symptoms of schizophrenia along with a mood disorder like a depression or bipolar disorder. So historically, what was happening was individuals who had mood symptoms with schizophrenia, they were clustered under the category of schizophrenia itself. But now we differentiate it. Now we understand that people with mood disorder, and schizophrenia might require separate set of treatments, and people with just schizophrenia symptoms might require separate set of treatments. So it's better in that we differentiate this and treat it. Okay. So prognosis is similar to schizophrenia. So the patients do not fully recover, and it's something which is long lasting and chronic schizoaffective. Okay. So that's a diagnostic criteria. So you have to remember two important points. So presence of both psychotic symptoms and the mood disorder, and the delusions or hallucinations must persist for at least 2 weeks in the absence of prominent mood symptoms. So in the absence of mood symptoms, at least the psychotic symptoms should be there at least for 2 weeks. Okay. So criteria. So let's see in depth all the criteria. So criteria A: an uninterrupted period of illness during which there is a major mood episode concurrent with criterion A of schizophrenia. Okay. So there is evidence of a major depressive episode or a manic episode. So criteria B: delusions or hallucinations for 2 or more weeks in the absence of major mood episode during the lifetime duration of the illness. So psychotic symptoms like delusions or hallucinations are present for 2 weeks, for at least 2 weeks in the absence of mood episodes. Criterion C: symptoms that meet criteria for major mood episode are present for majority of the total duration of the active and residual portions of the illness. Okay. And criteria D: the disturbance is not attributable to the effects of a substance. Again, this is the same criteria that we talked about in schizophreniform, where it shouldn't be attributed to any medical issues or any substances the individual is consuming. Okay. So here you can give specifiers by whether it's bipolar type, depressive type, or whether there is catatonia or without catatonia. Okay. So now how do we differentiate between schizophreniform and schizoaffective? So schizophreniform, again, the duration is between 1 month to 6 months, and schizoaffective, the duration is more than 6 months. So mood symptoms, when we talk about mood symptoms, it's not a primary symptom of schizophreniform. There might be mild disturbance in mood, but in schizoaffective, there is a significant disturbance in mood, especially uh, there might be flattened affect or on or any associated uh, symptom, mood symptoms or associated with bipolar or depression. Okay. Having talk about hallucinations or delusions present in when talk about schizophreniform, present but usually resolve within months, but in schizoaffective it is something which persists for longer duration. Onset in schizophreniform, it's rapid onset, but in schizoaffective it's something which is gradual onset. Prognosis again, schizophreniform has a better prognosis compared to schizoaffective, and premorbid functioning is better in schizophreniform compared to schizoaffective. And emotional affect, when we talk about emotional expression, and there is absence of blunted or flattened effect in schizophreniform. The individuals might have good emotional expressions, but in schizoaffective, it's significantly affected, especially with added burden of mood disorders like bipolar or depressive episode. The mood might be affected. Okay, so in the when we talk about treatment strategies, it's mostly antipsychotic medications with psychotherapy in schizophreniform, and schizoaffective we do use antipsychotic with some kind of mood stabilizers like lithium. Okay, I hope you understood the topics of schizophrenia and schizophreniform. Uh, and how to differentiate between schizophrenia with schizoaffective, and how to differentiate schizophrenia and schizophreniform and schizoaffective. Okay. I hope you like my teaching. Thank you.